It's all yours, Robin.
Okay, thank you so much. I appreciate the opportunity to speak with all of you today. I am Robin Edwards. As Cheryl mentioned, I'm a certified senior advisor and owner of Care Patrol of Northern Virginia. I wanted to give you a little bit of background about me personally. I spent most of my career as a journalist, writing about people's issues and problems. Fast forward to about 10 years ago, I found myself wanting to do more than just write about people's problems. I wanted to be part of the solution. And as such, that's when I pushed the reset button on my career and turned my attention to serving the elderly in our community. That's what appealed most to me about Care Patrol, just so that you know about this company. It's a network of about 250 offices nationwide. And what we're dedicated to doing is helping, as certified senior advisors, it's helping families find solutions to their care needs, senior housing and care needs, whether it's either finding assisted living, memory care, or in-home care. We are there to help them navigate the puzzle of complexities, which is the title of this presentation today. And in this presentation, I will give you a glimpse of the evolving senior housing market and care market here locally. Okay, let's just keep going here. So I'm going to set the stage with a little bit of statistics, many of which you've probably heard in other presentations. As you know, people are living longer. The life expectancy for Americans aged 65 is 19.6. It's longer for females at 20.8 years and 18.2 for males. At least 70% of the people over the age of 65 will require some type of long-term care services and support at some point. So one expectation as we age is that we're all going to have to, enlarge the circle of care as we age. So let's talk about solutions. For many, the desire is to age in place. That comes as no surprise to many of us. All studies indicate, at least 80% of seniors want to spend I'm sorry, my dog acting up. 80% of seniors want to spend the rest of their life in their homes, which is called, aging in place. To do so, though, it takes a village. The picture you see, I'm sorry, the picture you see over to the right of me and my best friend is Miss Mary. She's 95 years old. She's an example of somebody who's aging in place successfully on her own, pretty much. But as to make it work, and I always tell people when it works well, and what I've noticed over the 10 years is when they do have that village of people that come and offer them support to make aging in place a solution for them as long as possible. But life is what happens on the way to your plans. And what do I mean by that? Aging in place doesn't come with an expiration date. Changes can be sudden and unpredictable. So the person that gave me this quote was many years ago. It was a client of mine, and she was coming from, was it North Carolina with her husband, and their plan was return to Buffalo, New York, where they had met when they were 5 and 6 years old. They were driving up this way. They stopped here in Virginia, Northern Virginia, and the husband, who had dementia, went into a state of delirium. Ended up in the hospital. They never made it to New York, and turns out he was in the hospital. She had to. It ended up he needed to go into a memory care facility, so they decided to stay here. In the hospital, a marketer came in. She made the decision based on how nice the marketer was to place him in a place. Long story short, she discovered it was the wrong place. And then ultimately, she found her way to me, and I helped her navigate an appropriate placement for him. And one thing to note about memory care, and I'll just a side note, not all memory care options are the same, facilities are the same. So it's important to do your homework before placing someone in any of those facilities. And the reality is, at some point, we do have to enlarge that circle of care. In our community, as you all, many of you may know, there are a lot of elder orphans. These are these people that are physically and socially isolated and lack someone or a family member that can help them navigate the aging process and navigate the care options. This lady here was one of my she was my very first client. She lived in Falls Church, and she had lived in her house for 65 years. And it was time. She knew it was time to go. And she wanted to go many years into assisted living. She was just so dreadfully lonely. I worked with her through the whole process just to tell you how that the way Care Patrol operates, we never give families a random list. It's complicated navigating these options. So with her, it was holding her hand through the whole process and making sure she had the support she needed, touring with her, helping her with the paperwork. I mean, from soup to nuts, we did everything to help her finding movers and the like. So I became her support network, and she was able to move into a community in Alexandria. Okay. But there's times when aging in place is wrong, and we boil it down to two factors. One is safety, and the other is social. And we refer to it as SOS, the universal call for help. And I'm going to break those down to you so you have a clear sense of some of the signs. And we do educate our families with, pamphlets and brochures so that they can recognize the signs when a loved one may need to make a transition to a safer care environment. Specifically with safety, um, some of the warning signs could be wandering from home, signs of depression, neglect, um, unsafe behavior like leaving the stove on or the front door unlocked, dehydration. It could even be frequent falls, which patients that I get have fallen, have had repeat falls. So those are some of the warning signs as with regard to safety. Also worth noting is social. The National Institute of Aging reports studies that show social relationships are consistently associated with biomarkers of health, and social isolation constitutes a major risk factor for mobility and mortality. And that's highlighted part at the bottom is really important. The lacking social connections is a comparable risk factor for early death as smoking 15 cigarettes a day. And it's worse for us than well-known risk factors such as obesity and physical activity. So this loneliness is something that shouldn't be ignored with the elderly, and it does increase the likelihood of mortality by 26%. So let's talk about solutions. Um, there are many. Oftentimes, just so you know, when I get calls from families, let's say the adult children, the first thing they will tell me is, my mom needs a nursing home or my dad needs a nursing home. When I get calls from seniors, it's typically, I'm looking for independent living. They will ask for those things, but oftentimes it ends up being neither, that they're actually in need of. Um, when it comes down to the different types of options, independent living is just that. It's for people that can really function very independently, don't require a lot of oversight. There are some independent living plus communities where they have an in-home care agency on site that can provide piecemeal services if you needed help with some errands or certain things, maybe, dressing or on an incremental basis. That's independent living. It doesn't come with a whole lot of support. Home care, on the other hand, is with these agencies, and there's hundreds of them in Northern Virginia that provide, CNAs to come in your home or companion aides to come into your home to help with activities of daily living. There's so many of them that they're hard to navigate. So I always encourage people to make sure you do your vetting when you decide to bring people into your home. And we provide, families with all of these options, questions that they should ask prior to making a decision on what type of agency you want to use. There are life plan communities, also known as continuing care communities. There are a good handful of those in our area. Those are communities in large part that require large buy-in, typically, several hundreds of thousands of dollars, and they offer independent assisted living, memory care, and in some cases, skilled nursing care. And with those models, typically, you put down a large sum of money and then you pay on an additional fee on a month-to-month basis. And then there's memory care. Now, this is an area that I found for many families is really challenging for some to navigate, because there's so many different types of dementia, and likewise, there's various types of memory care options. They're not all alike. Over the years, I've seen the emergence of memory care communities that will have with, 2 levels of memory care, which is good, because I think it's good to have some separation for those at early to mid stage, and then those with more advanced stage that may not be as communicative. So there are those options. It's just a matter of knowing where to find them, if and when appropriate. And then there are nursing homes. Sometimes the biggest, I'll go back a little bit here. Sometimes the biggest challenge is finding a nursing home bed, especially after COVID. When you're discharged from the hospital, sometimes you'll have the stay in skilled nursing facilities that's covered under Medicare. But if you're looking for long-term care stays in nursing homes in Arlington, that can be a space that's very challenging to navigate. And also there's limited spaces here locally. So the big elephant in the room is always, when I meet with families and we have these courageous conversations around the kitchen table, is the cost. And the cost for these things is a factor that I want people to understand and know. No, your insurance is not going to cover most of these solutions that I mentioned previously. Home care is running about $35 to $40 an hour. And most facilities, most of the agencies here locally require a minimum 4 to 6 hour shift. Long-term care in a nursing home, it's going to be about $500 plus a day. Here. Assisted living, I can't see the bottom of that slide, but assisted living is to be determined, because a lot of factors go into assisted living. It depends on your location, your budget, and what your care needs are. And I'm going to go a little bit more in depth in terms of detail about what the costs are involved with assisted living here locally. But I will tell you, it is expensive and the cost is increasing. So now it's a time for a pop quiz. If you want to use your chat, there is, with assisted living, because the cost here in Northern Virginia is so expensive, sometimes people have to go to other locations, other states. And that's the beauty of Care Patrol. We operate in several states, so we can sometimes find solutions right outside of the immediate area that you may initially have wanted, if you can't afford it. So my question to you with this pop quiz, do you know what the most expensive states are in the United States for assisted living? And likewise, do you know the least expensive states? If you want to use the chat, and I'd appreciate it if you wanted to participate in that. But I'll just go fast forward. The answer is Washington, D.C. is the most expensive. So a lot of times if I have patients or people I'm referred to in D.C., they'll often look outside of Washington, D.C. because it is very expensive for assisted living. So they would often look, either in nearby Maryland, which is more affordable, or sometimes here in Northern Virginia. But DC is the most expensive in the nation, followed by the others that you see there. Virginia is ranked 13 on the list, and these numbers are provided by Genworth, that does a study every year where they publish these numbers. The median for the state is $6,050. However, more realistically in Northern Virginia, our prices are more aligned with what is in Washington, D.C. So a lot of times I hear in Northern Virginia, if there are people that are looking for assisted living, I'm not going to find something at that median price range. We'll have to look outside of the Northern Virginia area, maybe further south or west, to find more affordable options that align with the rest of the state. And likewise, the most inexpensive is Mississippi, where the median cost for assisted living is $3,800. And then, so in this area, I will tell you a lot of the families that I get will transition to nearby Maryland. I have a patient now, well, I have a client now who's living in Northern Virginia, in Alexandria, in assisted living in Old Town. And he's what, 95 years old, and he's starting to run out of money. So, you know, my conversation with the family was we were brainstorming, okay, we've got to make his money last. It turns out with his budget, they had relatives in Baltimore, and we discovered in the course of the conversation, out in Baltimore, you can find something for about $3,500 a month. That's unheard of here. So location matters significantly when it comes to affordability. So in this study, this was part of that Genworth study as well, and this is where they're forecasting the cost for assisted living in the future. So remember the median cost for assisted living in Virginia now is $6,050 a month. Fast forward to 2023, that's going to be $9,038.6 a month. Ours again is more aligned though with the Washington D.C. area, which has it at over $9,563 a month for assisted living for a 1-bedroom, and it's predicted to be up, you know, over $11,000 up in 2032 comes around. Oh, and just one thing I just want to say, when you go to these communities or you look online and you see these prices published for assisted living facilities, they always say pricing starting at. It's because it's not just based on, it's based on several factors, which your actual cost will end up being the size of the room. So yeah, this is for a 1-bedroom, but if you were to get a studio or a shared suite, that price point is going to be less. But also the other factor is to consider is each of these facilities add on a cost for your care. So that's to be determined. So when they say prices starting at, it is just starting at that. They're usually additional costs that are expenses that are added on. So question I often get, how do people afford this? How do they pay for it? In Virginia, the state of Virginia, it's private pay primarily. So no, your insurance doesn't cover it for the most part. There's government assistance in the state of Virginia. There's the auxiliary grant program that helps subsidizes the assisted living in some communities. That's for people that are at a very low income threshold to qualify for that. The wait list for that is pretty extensive. You know, for those that want to stay in their home, there's reverse mortgages. Long-term care insurance for those that have it is also a way that people are paying for care. And with veteran assistance, I work a lot with the VA. Veterans assistance is the Veteran Aid and Attendance Program, which supplements the cost for assisted living for veterans and their spouses. So that's again for people that are at a lower income threshold. For those that have to apply for that, the wait list for that is now, just to get approval, is running about a year's time. And then there's life settlements where you take care of your life insurance policy and you can, you know, cash that out to finance your long term. So just to talk about the housing market here locally, just so you have a sense of what's I've noticed over the years, I'm going to talk about some of the trends. There are assisted living communities opening up constantly here. I go to openings, I would say at least every month, there's something else opening up. And there are a lot of these options are opening up with the focus on hospitality. So they're grander, more resort style communities that are emerging in this Northern Virginia market. There's also in this Northern Virginia market, which I'm happy to see, many more small residential care homes. These are homes that are licensed for usually a maximum of 8 residents each. And it's for people that need, that have higher levels of acuity, that need just more hands-on support and TLC. So as opposed to going to a nursing home, some of these homes are licensed and set up to care for those that need just more hands-on care and supervision. So I'm glad to see that there's a lot of those. If you go over to Montgomery County and PG County, There are hundreds of these homes. There are not that many here in Northern Virginia. So, but there are more and more that are beginning to open. And then just last year, Arlington got its first um, home, as a residential care home that opened up. So, and unfortunately, they are expensive, but they are a good solution for those that want alternatives to going into a long-term care nursing facility. As you all know, pricing is going up. No surprise there, especially after COVID for these options. But so is the level of competition. So one thing I want to leave you all with is, if when you know where to go, and this is where I help families navigate these options, knowing where to go, where sometimes there is some room to negotiate, because yeah, more and more places are opening up, but the competition is getting steeper. So sometimes you can negotiate for some incentives, and some ways to kind of reduce your financial burden going in, especially as it relates to the cost for the rent, which you know, can be adjusted in some cases. And then what I'm seeing too in this market, just in general, I work on the housing committee for Fairfax County, and one of the things that we're exploring, you know, because in this community, there are the haves and have-nots, and then there's this middle market where a lot of us find ourselves in. We don't we don't qualify for the auxiliary grants or Medicaid. We can't afford these places that are running $9,000-$10,000 a month. So for the middle market, there's the quest for solutions. It's a long time quest since I got in this business, to find something where those in the middle market can thrive in, you know, in housing environments with support. So one of the things we're looking at are house sharing opportunities, and ways to promote that, as part of the solution. And the other solution that we find for families, and and as the prices are starting to go up, is considering relocation. And because Care Patrol, we have offices throughout the entire DMV and beyond. Sometimes, as I mentioned previously, the solution is to kind of stretch outside of this immediate area. The further you go away from DC, the costs tend to be a little less expensive. So I'm going to spend a little bit of time on some myths, misconceptions, and mistakes I see families make often. And one of them I often hear is, if we run out of money, we'll just use Medicaid. It doesn't, unfortunately, work that way. Um, I mean, a lot of people assume that they can just get Medicaid, but it's complicated, and always refer families to elder law attorneys so that they can navigate that space and not get declined. Um, and then I also often hear, and this a lot with patients that I visit, what do you mean insurance doesn't cover assisted living? Many are surprised that it isn't covered, but in the state of Virginia, as I mentioned, it's all private pay. So consider that a myth. It doesn't. And as I mentioned before, you know, when I get these misconceptions about these types of options, when I said earlier the adult children would call and say, Mom needs to go to a nursing home. One of the trends over the years that's been kind of nationwide, observation that we've made, is that with these, sometimes when nursing homes aren't the only solution, there are cases when a nursing home is required for patients' care. But sometimes a person may be a fall risk, or just need more hands-on support with mobility challenges or with transferring. These small care homes can be a solution. So, you know, knowing that space and knowing which ones are set up to handle those higher levels of acuity can really provide a great solution for families that are, you know, dealing with financial challenges. And then often hear this when, you know, I hear from the adult children, we went out looking and found a beautiful place. And it's the, you know, it could have the fancy chandelier and walking past, and it, all these pretty things. Again, when you go in these communities, the focus is on hospitality. They're selling this, they're selling, targeting sometimes the adult children to kind of encourage them to consider the community. But ultimately, with Care Patrol, one of the things that we do is provide families a list of questions, and I think it's a long list of questions, and it relates to care. We want to know, we want them to ask the questions so that they can make a well-informed decision as it relates to their community staffing levels, their response times. it's a lot of things that go into understanding the care services and what are provided and what's appropriate for your situation. And the mistakes that I've seen over the years, and as a caregiver, I can relate to this because I've made this mistake too with my loved ones. Sometimes I'll hear, adult children will say, call up, they'll want help, and then they'll get shy or they shy away from moving forward in terms of placing mom, even though they know. And I have a case like that now where it's a son and his mom lives in Arlington on her own. She's starting to do things like wander and leave the front door open, and he's kind of going into denial. And he's like, well, I'll find a way to take care of her. Oftentimes families, and I've experienced this myself, the role of a caregiver cannot be taken lightly, and it has a toll, and it at some point taking care of them, even if you bring in support, oftentimes it just can't sustain itself over time. So to avoid that mistake, I always encourage people that, okay, I get that you want to help and take care of mom, but let's focus on a plan B so you don't have to, in a crisis situation, make these types of decisions. And then the other one that I hear often, because we're in an on-demand generation, we want solutions quick. When people call me and they'll say, I filled out one of those online forms. Let me encourage all of you not to do that when you're searching for these types of communities. I don't know if you all have experienced it, but oftentimes you fill it out. And first thing you need to know is once you say you put all your personal information about your loved one in there and your contact information, and then they'll say, click to speak to an advisor, what you're actually doing is signing a contract. And it's a contract that's not easy to get out of. So,
oh, interesting.
yeah, you can't, yeah, I mean, you're technically, you're becoming one of their clients. So I always encourage people, don't fill out those forms. Um, and then two, the other thing, the headache that you'll get is once you fill it out, you're going to be spammed. Your number's going to be spammed out to everyone in the areas that you mentioned, and you'll just get bombarded with calls from marketers. It's not a lot of fun. And then oftentimes those people will get so overwhelmed with all that that they end up coming to me, but I'm limited in my ability to assist them because they've already in their contract that you unknowingly signed became their client. So let's talk about here, and I'm gonna go back here. Solving the puzzle. One of the things that I encourage people to do is, while we don't know, we can't forecast an entire financial plan for our senior care, pre-planning is critical. And I say it's critical because ultimately I want the senior to have a say. I think it's important to have a say about what happens when life happens, and if they do need to make these major decisions about, their care needs later in life or going into a community, I think it's important that they have a say. So do some pre-planning, do some homework. I think presentations like this are excellent. And I'm glad so many have joined today because I think it's important to kind of think this process through ahead of time. Recognize the SOS signs because there will be a time when you have to enlarge that circle of care. Aging in place, as great as it is, does have an expiration date. And to recognize that, recognize it doesn't hurt to work on a plan B. And lastly, the note that I leave everyone with, final thought, is all these elder orphans that I help in the community, there's a lot. I work with Arlington County a lot to help them. I just want to leave you with this point that we all have a part to play in helping them in our respective communities. So each one reach one. There are many in our community, and I think it's important that we all play a part in providing solutions for them. And with that, I welcome any questions that you all may have.
Okay, well, we do have a number of questions, some of which you touched on, but I'll repeat them anyway so you can reinforce the message. First one is, what are the different types of assisted living? What's considered assisted living?
Good question. So assisted living is it provides It can provide it's set up to provide general care and supervision. So in assisted living, they provide support with your activities of daily living. They provide opportunities for socialization and engagement. They, of course, have the amenities that I referred to previously. And, you know, if you needed help with medication management, they're there to assist you. But they're also set up to promote your independence and encourage your independence. So with assisted living, you have the freedom to come and go like you want. Unlike some people think, oh, I'm just going to be locked into this place. No, you have the freedom to come and go as you want. But there are people there, staff there, caregivers there that are there to provide you with support as needed. And that's primarily with your activities of daily living, bathing, dressing, grooming, and that sort of thing.
You do care assessments and care plans.
What we do is we do what we call a care discovery, and it's about 70 questions that when we meet with families or patients that we ask them, and it's about, you know, what type of support they need in terms of their activities of daily living, their what they're able to do, their preferences, you know, lifestyle preferences. So yeah, we ask a long list of well thought out questions to get a picture of what might, and when they're looking to transition to assisted living, what particular community may be appropriate for them. Let's say they, you know, have pets and have a dog or something they want to bring. So there's some communities that accept dogs. There's others that have other strict rules over what type of dog you could bring. What we do as part of our process is pre-screening all these communities ahead of time. So when you reach out to us, we can narrow down the options and present you the ones that most fit what you request.
You mentioned that Care Patrol is active throughout the DC area and beyond. Can you tell us what and beyond means? How far out
Sure.
do you go and where do you operate?
So I operate primarily in Northern Virginia. So cover Arlington, Alexandria, Fairfax, part of Loudoun, and part of Prince William County. We have offices in Frederick, Loudoun, Richmond, Virginia Beach. We go as far as Virginia Beach, going south. And then we, you know, have offices in Maryland. We cover the whole state of Maryland. And when I say beyond, we have 250 offices that stretch from Seattle, Washington, to Sarasota, Florida. So we're across the United States, except for West Virginia. I think it's one state we don't represent.
Okay, we've got a couple of Pennsylvania fans that weighed in when you were talking about relative costs. Somebody said Pennsylvania is less expensive than this area, and somebody else who said Philadelphia has great hospitals and other facilities. So,
Mm-hmm.
does home care include just an hour or two of help, like light housework, or what exactly is included, and how much are you expected to pay for each week?
So it's home care. I just had a case out of Arlington recently. The county sent my way. It was a woman that wanted someone to come to her home an hour every day around lunchtime to take her to go get a sandwich and maybe just help with something minor. There, the way those agencies work, none of them would take the case. I tried some of the larger cases and then tried to phone a friend to see if they might be willing to help some that own some of these home care agencies. The challenge with home care is today is that there's a shortage of caregivers. So now all of them do require a minimum 4-hour shift. So, and others are requiring now 6-hour shifts. So the demand for caregivers is very high here locally. So those longer shifts are required if you really want to get support in a home. And as I mentioned before, the cost is going to run anywhere from $35 to $45 an hour. Um, it just depends. And the type of support they provide in the home, they can help with meals, grocery shopping. Some will provide help you with transportation to doctor's appointments. Um, they're there just to provide you that hands-on support. Some cases, when you call, you may just need like a companion aid. There's usually less cost for a companion aid. This is somebody that's just there to be, you know, social support or just to be serve as a companion for the senior on an incremental basis. But still, too, those usually require a minimum 4-hour shift.
Okay, and is that 4 hours every day, or can you contract to say, I just want somebody in, Tuesdays and Thursdays?
It's as long as it's for a 4-hour shift, you can have a 4-hour shift Tuesday and Thursdays. But again, it
Okay.
depends on the agency and whether they have the caregivers available to meet that shift.
Your chart of relative costs showed Virginia at number 13. And this person wants to know if you're just looking at Northern Virginia, not the rest of the state, where would we rank? And we're talking Northern Virginia, not the DMV generally.
Right. So Northern Virginia was the figure I had for the DMV. The rest of Virginia is that lower price point that I mentioned earlier, that 6,000 or so a month price range. Am I answering the question correctly? I'm not sure I followed that.
Yeah, well, they were saying, yeah, 6,000 a month was for all of Virginia, right?
Yeah. If you went
And they
further
wanted to
south,
say, if you're
hmm
just talking Fairfax, Arlington, Alexandria, maybe Loudoun, where would we
we're
rank?
more in line with what the higher price for Washington, D.C.
Okay. And I think you already answered this with a no, but they asked, does Medicare or Medicaid pay for assisted living?
No, what Medicare will pay for is any, PT, OT that you may need while you're in the facility. But in terms of your custodial care and your room and board, that's going to be all private pay.
Okay. Do you work with elder orphans, people who have limited family support but want to put a plan in place for care as they age?
Oh yeah, all the time. And with them, sometimes it's a longer process. I've known some of these folks for many, many years. Where it's a process. It's not something that they're usually not like that first client I had when she was definitely ready after 65 years of living in that house that I mentioned previously, my first client. But yeah, with the elder orphans that I meet, it's a process. It's an ongoing process. It's many conversations before they get to the point where they're usually ready to make a move.
We talked about Medicare and Medicaid for assisted living. What about nursing care or nursing home stays?
With nursing home stays, if someone's looking for a long-term care bed in a nursing home, there are some options here. Some of the nicer ones are in those continuing care communities that are like Goodwin House and Green Spring. The challenge is that to get long-term care beds there, they're very limited, and most of them are reserved for people who are already in their continuing care network. So those are where you usually find the nicer ones. Um, Navigating the space outside of that since COVID has been one of the biggest challenges families face, finding a decent nursing home.
No, I
It's
think the question is, do Medicare or Medicaid pay for any part of a nursing
Medicare
home
will pay,
stay?
when you're in the hospital after a 3-night qualifying stay in the hospital, you can go into a skilled nursing facility, a nursing home for so many days where it's covered through Medicare. Okay. After that, it's private pay. If you need a long-term care, it's going to be private pay unless you qualify for Medicaid. And if the facility has the Medicaid long-term care bed available, that's when Medicaid would kick in. So, but you would have to qualify financially. Otherwise, it's private pay at what I quoted earlier, about $500 a day.
Okay. I've got a comment here that this person's sister gets a housing opportunity grant from the state of Maryland. Does Virginia have anything like that?
I'm not familiar with that. As far as I know, we just have the auxiliary grant program. that would
Mhm.
it subsidize the cost for assisted living.
And another comment, they like the idea of the house sharing. It would help in a lot of ways, but it's obviously not suitable for everybody.
Yep.
Next question is, how do you get paid for the assistance that you provide?
So that's a good question. We get paid by the thousands of providers in our network. So in that sense, there's no charge to families for the services that we provide. We're compensated much, by the providers. So in this case, specifically for us, Care Patrol, when there's a placement, we get a fee from the making the placement. And so that's how we're compensated. But there's no charge to families. There's no charge for hospitals or rehabs or anyone to use our services.
Okay, there's a question here about whether this would be posted, and the answer is yes. We're recording this and it will go up on our YouTube channel. What do you do if the family calls you in, but the elder person refuses any help?
Oh, that happens all the time. So yeah, a lot of people are reluctant, and it's kind of we do provide families with some guidance, and in every situation is different. And we give them information on how to have this conversation with their parents, one, but also it's a process of, m- m- encouraging them to be a part of this big decision in their life, or at least have a say in it. So unless they want somebody else to make the decision for them, and sometimes just getting them to go and visit a community. Some of them I find have misconceptions about what these places are, but it's an education process. And I think if we can take them along slowly, kind of at the pace, and let them be in the driver's seat for the most part. A lot of times with adult children, I'll ask them to go out with me first and narrow down the options so it doesn't get so overwhelming. And then, present them the options that the family thinks is best for the senior, and then going for a visit, not only just a tour, but go back for maybe an activity or go back for lunch. These communities are used to this being a challenging process for seniors to navigate and have to warm up to. So um, it can be done. It's just a matter of not trying to force someone, but educating them and introducing them to the many benefits that some of these communities offer. Too often, I will just say this, a lot of the seniors that I work with, moving them from their homes, they will go really kicking and screaming and nervous about the whole process. But, what I've seen and what makes me happiest is when I go back and I see them. And like that very first person that I placed that I showed you a picture of previously, the first thing she said, I wish I did it a long time ago. It wasn't, she said, I was so fearful that it was going to be the end, but it ended up being a whole new beginning. So I've seen those new beginnings and great outcomes, but it's just getting over the fear factor for many of
Okay, you mentioned that there are places like Goodwin House that have waiting lists to get in. Do you think it's a good idea to pay to get on a waiting list, even if you don't anticipate using it for a number of years?
them. No. And this is why. To go into, it depends. Now, if you're thinking that, okay, should something come available, I'm going to jump on it. I'm ready to make a transition. But if you're looking 5 or 10 years down the road, you might have put your money into something that may not be appropriate for the level of care that you currently have. So remember what I said about, you know, that unexpected expiration date for remaining in your home, the multiple comorbidities and things like that that come with aging often come into play over time. So you may have put your money down for independent living at, let's say, Goodwin House, but your care needs may be such that that's not even appropriate for you anymore. So it just requires just a lot of soul searching to say, if you're ready to jump on it with some immediacy, to go into any of these communities, and this is one important factor, the state requires before you go, you're admitted into assisted living, that the facility, does an assessment. And that assessment has to be done within 30 days of move-in. So if your care needs are drastically different from what they were 5 years ago when you put down that money and say, I want to go here, you may not be appropriate for what you put your money down on. So I would discourage that. I think that could be a little problematic, and not all places will refund that money. So you just have to ask questions to make sure it's not going to be too risky for you.
Okay, Robin, just so you know, we're about 10 minutes to 11, and we've got quite a few questions queued up.
Okay.
Um, so once Care Patrol helps place somebody, do you continue to help that person and make additional referrals if they need other services like moving or downsizing?
Yeah, we have our model's built on a social work platform. So yeah, we follow up at certain increments after someone moves in, usually right after they move in, and usually a 5 day, 10 day, 30 days, and then as much or they need. We also check in with the facility, make sure that there's no issues. But we follow up with the families because we try to monitor these facilities for care and safety. And if there are concerns about staffing or things like that, we want to be informed about it. Um, because one of the things about Care Patrol I didn't mention, yeah, we have thousands of these providers in our network, but they're all pre-screened for care and safety. If it's a facility with a lot of deficiencies or staffing issues, we won't refer to them. So it's important that we know that information, and so that we can provide you with quality option when we meet with you. And so, yeah, we do follow up with families so we can get that feedback and we enter it into our database and keep that on file.
Okay, I think this goes back to your SOS slide, but at what point should I or would I need to engage Care Patrol?
If you want to just start having the conversation, if those warning signs are coming into play with yourself or your loved one, and you're like, I, I see mom's doing this or that, and I think we need to be prepared. That's when I would say, let's just have this conversation. Let's go through those 70 some odd questions that I mentioned previously, and I want to present you maybe, and usually we give families, when we start, narrow down the options, 3, because we don't want them to get too overwhelmed based on the information they provided, so that they can just start getting familiar with them. Then we work with them to go on a tour. So it doesn't hurt. I think the more educated you are, the less intimidating it is when you do, or you're forced to have to make a decision. So, educating yourself, that pre-planning that I mentioned in the last slide, will really help you in the long run, so that it's not just an overwhelming decision later in life.
Okay, how do you ensure that the places you recommend are safe and have passed the necessary state health and safety requirements?
I'm sorry, could you repeat that? I'm sorry. Forgive me
How
one
do
second,
you,
please.
okay,
Okay, okay.
how do you ensure
All
the
right, could you repeat
places
that
you
question, please?
yeah, how do you ensure that the places you recommend are safe and have passed the necessary state health and safety requirements?
Okay, there's one you can find in the state of Virginia. Um, they do, there's a website where you can check the state surveys for assisted living. Sorry, I just got my dog agitated here. Sorry. Um, okay, my apologies. So
That's
yeah,
okay.
for nursing homes, you can go to Medicare.gov, and they have the inspections for the surveys for the nursing homes. You can find out all that information there, where they rate them. And then in the state of Virginia, you can go to the Department of Social Services. That's where they have the most recent state surveys. And you can see if they have any deficiency. We monitor those, and that's where we start. again, we're in and out of these facilities often and in contact with them. So, you know, oftentimes, even if you read those state inspection reports for the assisted living at the bottom, it has this little, statement at the bottom that does not signify the quality of the facility. It's a little disclaimer. And it's true because there's always usually more to what's going on when you see those deficiencies. And I encourage families when we meet with go on tours that they sit down. If they have some questions about, let's say, if there's some medication management issues, which is very common in a lot of these communities, that they just ask the provider about that. What have you done to rectify it? Because not only do they list the deficiencies, but the facility has to say what they're doing, fix it. So that's where you can find out the information. But it's really just us monitoring them, being in them, and just knowing them as well as we do because we are working with them so closely.
Okay, next question. Are you seeing more multi-generational family living arrangements?
I haven't noticed that a lot,
Okay.
but I've
What
heard of it.
okay, what is the average time for a person to get adjusted to moving into a retirement community?
So this varies. It depends. Usually, when I've had some of those that have been reluctant, if it's a good fit, I would say, and I talk to some of the marketers sometimes, and when I do the follow up, and it's amazing that usually after about 30 days, they start to really get used to the rhythm and flow of it and getting, I would say 30 days. Um, usually I've had some patients where, after the first week, mom's complaining, I want to go home, I want to go home. And I usually just encourage the daughters or whoever the family members are, just wait it out just a little bit longer. Now she doesn't want to go home anymore. So it is a process for everybody. It varies for each one, but I would say about at the 30-day mark, they usually start getting pretty well adjusted.
Okay, you said you get paid by the providers in your network. Can you provide a list of those if somebody asks?
There are literally thousands. So I work with all of the communities here in Northern Virginia. And too, because I get them from the county and from the VA, Veteran Affairs, some of these, a lot of what I do, just in full disclosure, is pro bono. Some of these people just need help navigating even the options, let's say, such as Culpeper Gardens. They're in Arlington, or whether there's, other types of providers that we may work with that don't necessarily pay us. So the nature of what we do, there's a lot of work that is pro bono. So I don't have a long laundry list because I work with all of them, even folks like that are looking for these continuing care communities where we don't get compensated by them, but I still work with people navigating those options.
Okay, we had a comment here that Goodwin House has changed their waiting list process and you can no longer be on it indefinitely. I don't know if you know anything about that.
I wasn't aware of that, but it's a popular option. I can understand why.
Okay, and there's a question here about having someone to back up people's financial transactions and help manage their assets. Do you do anything with helping connect people up with financial planners or managers?
Yeah, I do that often. As a certified senior advisor, I can't offer families any financial advice, but I do work with financial planners and estate planning attorneys that I've referred to that can help families put together that financial piece of the puzzle.
Okay. We've got a question here about when is this video going to get posted. I'm going to try and get it up today, or if not today, it will definitely be up tomorrow. So you can check on our YouTube channel. Um, and let's see. One question that somebody had was if you pay for a home care person, 4 hour or 6 hour shift, but you only need help getting up in the morning and getting dressed and eating, what do they do for the rest of that shift? Is it up to you to find work for them or,
Pretty much. Yep.
okay,
Pretty much. So, I think, so they'll encourage them, like, well, maybe get them do laundry or something. But that's been a challenge, especially
Complaints about
after
that.
the pandemic, where the agencies used to do like a 1 hour here and there, but it's such a shortage of caregivers, they just don't have that option anymore. They're making it the 4 hour to 6 hour shift. Even at there's some place, another agency reached out to me recently where they will do an hour, but it's like $85 an hour.
Whoa.
Yeah. It's
A lot for 1 hour.
a lot for 1 hour. I don't even refer people to that. I mean, 'cause that's kind of a lot.
Yeah.
so it sounds like it would be a good idea to have a plan, after I finish breakfast, I want you to prepare my lunch and put it in the fridge and,
Exactly.
do this, do that, start to
Yep.
run a load of laundry. So,
Yep.
Right.
all right. Well, I don't see any other
Any
questions that you haven't touched on. If anybody's not happy with an answer or has a new question, now's the time. Otherwise, we're at 11:02. So,
So
time.
Robin, I assume that if people do want to get in touch with you, what's the best way?
Okay. That's it. Right here. There's my
Okay.
contact information there. And always just, anybody on this call, feel free to give me a call if you just got some general questions or want to pick my brain. I don't mind. You're welcome to reach out.
Okay. So Gary, is there any more messages? I don't want to forget anybody. Otherwise, we
Just a comment here that about hiring somebody for an hour. That's very hard to make a living doing, an hour here, an hour there.
Yeah.
Home care isn't exactly the gig economy the way food delivery is.
Right.
Otherwise, somebody saying thank you. This was enormously helpful, very interesting.
Oh,
Yes.
thank you.
Well, I couldn't agree more. As I said, I've been pleased to know Robin, and she was actually one of my first guests, maybe like the first year or either the second year, either in 2017 or 2018. So I have known her a long time. So she came highly recommended. So, and you didn't disappoint. The presentation was fabulous, Robin.
Oh, thank you. Appreciate that.
The
Okay.
contact
And
info-
I apologize for my dog's interruption. Her timing's always perfect.
We totally understand. Dogs are good companions and help in social isolation.
Yes.
So given it's 11:04, we will let everybody go, but remind you that next week we have another interesting presentation. It's called Art Against Ageism. And we have several guests, Meg Laporte and Jordan Evans, who are founders of an organization called Art Against Ageism. And we'll talk about how artists are working to combat ageism in the art world. So that'll be a good presentation. Starts at 10 o'clock on Coffee and Conversation next Wednesday, January 22nd. So be sure and tune in to that program as well. And meanwhile, please stay warm, dry, safe, and we'll see you next week. Have a good week.